Hello, everybody. Brian Gleis here. I've got Matt Spate with me, and then joining us remotely is Mr. Mark Blassie. And as you know, or if you don't know, we are your benefit builders. We work for the Scott Agency. Matt happens to be our CEO. I'm one of the executive producers. And Mark Blassie is our keystone partner, and we work together to help employers just like you get more out of their employee benefits. Now, our experience is that there's a good chance that you have just recently went through your group health insurance renewal for 2025. We know a lot of our partners renew in January. Then there's another whole group that renews in June. So today, what we want to talk about is kind of a post-renewal debrief. No doubt that the renewal of a health insurance policy can be stressful. There's a lot of ins and outs that needs to happen, but now that's set and it's behind you. That's really, believe it or not, where we want to come in and visit you. Now that the pressure's off, if you've watched any of our previous podcasts, you'll know that we're not product pushers. We're not insurance salespeople. We want to be your trusted advisor. And the way we provide benefit to you is to make sure that your plan is working as efficiently as possible. And that's what we've talked about in previous podcasts. But today, we're going to talk about that post-renewal review. We have a lot of different resources that we can utilize. One of the things before I turn it over to Mark that I want to show you is we have all different types of statistics. And when we're talking about what criteria that you guys use when selecting a broker, if I just look at the top five promotes prompt and effective service to answers and questions that you have, that you want a trusted advisor versus an insurance salesperson, that we, your trusted advisor, have the ability to challenge and or negotiate a renewal on your behalf. We offer resources to help keep you in compliance, that dreaded C word for compliance. And we offer that to your organization. And we offer a wide range of services to meet your human resources, employment benefits, and employee health and wellness needs. Now, one of the things that I find interesting, those top five, nowhere does it mention price. Now, we know that price is important to you, but what we're here to say and talk about is, has your current program, has your current relationship enabled you to get the best price and to have your product as efficient as it possibly can? Mark, will you kick in with your ideas on the post-renewal debrief for 2025?
Sure, Brian, and Happy New Year to everyone. And it's a pleasure to be back in 2025 to continue the Benefit Builders podcast. Brian, I think one mistake that is often made during the renewal season is not having enough time to really look at the intangibles in your relationship. There's such a rush to renew, to get all decisions, mainly financial decisions, made prior to that renewal date so open enrollment can be planned. And what we often find during post-renewal debriefs is the lack of the intangibles, and you mentioned many of them. One thing that we often find in building a new relationship is oftentimes carriers aren't fully engaged. They aren't fully engaged to help support the education of the benefit program, not only to the plan sponsor, but to the members themselves. As an example, and Matt, I know you really try to zero in on two different types of plan designs, and you can speak a little bit more about them, RX and telehealth, how oftentimes the carriers supporting services just aren't really tapped into.
Very much so, Mark. So Mark and I have worked on some larger groups together, and there's a lot, like he said, there's a lot of things that a lot of brokers don't touch on in pertaining to benefits that your plan might have that your employees don't even know anything about. One thing we like to use is this agency scorecard. This is something that we can give you after the renewal and ask, is there anything on here that your agent did or did not discuss with you? And Brian, you can share this on the podcast later. But
Absolutely.
we think this is very beneficial to show possibly what your agent isn't doing. A lot of times, like Brian said, they're focused on price. They want to tell you how much the renewal went up or down, whether they got the renewal down a little bit, and then it's time to renew. Well, there's lots of other things that we can help you look at to decide what's going to be best for you. And a lot of times, after the renewal cycle hits, when things have slowed down a little bit, that can be the time to do it.
Totally. And let's give some examples. And I'm going to speak directly to my employers out there. If I was at your facility and I took a walk onto the work floor and I walked up to 5 of your employees and I said, guys, can you tell me where to locate the phone number to your telehealth advocate? Can they answer that question? Is there a poster located in the break room that has the telehealth phone number on it? We have had large success with creating magnets. Put it on the refrigerator. Put it on the guy's toolboxes and things like that. In most cases, telehealth can be one of the lowest forms of healthcare. Generally, it'll have a $0 copay. Even if it does have a copay, the employee doesn't have to leave their home, doesn't even have to leave your work site. I've worked with employers to set up a kiosk at your work. Not that you want people sick coming to work, but if someone is feeling a cold or has a rash or has a sinus infection or something, there's not a lot of employers out there that will say, hey, we'll log into telehealth, we'll wait out the hold time and call you in when they come on. Think about how far that would go with retention of employees and potentially attracting talent that you don't already have. That's the efficiency piece. Let's talk about the RX that Mark talked about. If I walk up to your employees and say, hey, do you know there's a possibility to save money on your prescription drug costs if you would subscribe to the mail order program? Did you know there was a mail order program? Do you know how to access the mail order program? Well, once again, it's something that your broker should be doing through communication. We do it through videos. We do it through emails. And with some of my groups where the employers allow me to, I email this stuff directly to the employees. Other times you guys have a briefing once a month or things like that. These are strategies. And if you are not implementing the best practice strategies, the upcoming years are not going to be friendly to your organization. Mark, what would you add to that?
Brian, one theme that seems to be common throughout all our comments this afternoon is how to effectively communicate down to the member level. And I know this is post-renewal debrief, but I think we should talk about the open enrollment support that we provide our clients during that critical touch point with their employees, whether it's done in a group setting or one-on-one sessions. That is a critical time to communicate. And again, I know it's post-renewal, but I think it's worth addressing because some of the touch points that we do on an ongoing basis, they're just reinforcing the open enrollment messages that we deliver.
No, absolutely. And when we're going through an open enrollment, we want to meet with your employees. We want employee questions. We've been successful at using surveys to determine what the employees want out of their health insurance, what's most important. During these open enrollment type discussions, we may find that a hospital indemnity plan would be important because in order for you, the employer, to survive, you're going to have to take a higher deductible. We may have to look at some voluntary services that you don't currently have. The devil's in the details, and we have to plan on those. So to give you some examples as we move forward for 2025, I've got a note here, and I'm going to pitch it to Matt on the most common thing that's out there right now, the GLP-1 drugs, the weight loss drugs. you want to go over your statistics that we have on those weight loss drugs and how they're going to continue to grow and affect healthcare costs in 2025?
As most of you have heard, even if you haven't taken a weight loss medication or attempted to take a weight loss medication, you surely know someone who has family member, a coworker, a friend. Some of these statistics here say 9% of the U.S. population could be on a GLP weight loss medication by 2030. And GLP medications typically cost around $1,000 a month. Most of our healthcare companies currently are not paying for those unless your blood work has some sort of diabetic tendencies. You're either a diabetic or your blood work is close enough to where you're approaching diabetic numbers. In most cases, if you're not in one of those categories, you're probably not getting the health insurance company to help you pay for it, which has become an issue because it really is helping a lot of people, but they're having to pay for a lot of this out of pocket. And that's going to be something we look at what possibly could change later in the year.
And education is a lot of the key, guys. The GLP-1 drugs, I personally have taken them, and they are phenomenal. They take the cravings away, they take the food urges away, and things like that. But the issue with the GLP-1 drugs, and this has to be addressed through communication with your employees, whether they have diabetes or whether they're just doing it for weight loss, the drug is not a cure. The drug is not a solution. If you are not changing lifestyle habits while you're taking these GLP-1s, as soon as you stop taking the injection, the weight will go right back on. That's one of the issues that the healthcare insurance companies have. The folks that are not diabetic and just want to take it for weight loss, they will drop pounds automatically. But if they do nothing to change their lifestyle, it'll zoom right back up. That's the resistance that we're seeing in the industry. Specialty drug spend is also becoming more and more and more on our radar as new types of therapies comes out. If I could snap my fingers and cure cancer tomorrow, I would. But we're getting closer with those things. And as these specialty drugs come on the market, we're seeing prices increase. And if your broker is not talking to you about strategies, both before renewal and continuing after renewal, there's a good opportunity that the Scott Agency and Keystone can be a valuable part of your trusted advisor team. And that's what we're here for. I like to call Mark the architect. And whenever you look at our past podcasts, you'll understand that Mark is our access to all the pieces of the puzzle, whether you're level funded, whether you're self-funded, whether you're fully insured. We can have conversations on all of these things. You will see all of our faces, but Matt and I are many times the boots on the ground. We're meeting with your employees. We're giving them their brochures. We have the ability to do this virtually. We have the ability to record videos just like this one and send them out on emails. And then depending on the logistics, your employees are always welcome in our office. But due to the tactics that we use, we have the opportunity to work with people all over the state of Missouri. And I'm happy to travel. I'd be tickled to death if your business was in the Lake of the Ozarks. I'd like to come visit you every other Friday. Okay. But no matter where you're at, our main goal is to help you, the employer, survive this thing called health insurance, provide your employees a benefit, and allow us to give you strategies to help you survive the doggone thing. Right now, outside of renewal, is when Matt and I and Mark can gather the information, see if you're using your policy as efficient as possible, seeing if your broker is a salesperson and not a trusted advisor, making sure they're following up with action items. We'll give you the scorecard to fill out. We'll give you the information, and the information that we give you is not propaganda. It's vetted by legal. So we're here to make sure that once we have you, we'll keep you for many, many years. Mark?
I think my closing, Brian, is to say a post-renewal debrief is a best practice that often leads to finding some improvements. Our approach is not to degrade your current relationship, but to just help you understand how we measure performance according to our pillars of excellence. And it's just it's a best practice, and we do it free. So I think it's something that should be considered more regular.
And Mark, thank you very much for bringing up the pillars of excellence. If this is the first time you've seen a Benefit Builders podcast, find our other podcasts and take a look at them. And we go into details of what the pillars of excellence is. It is the base platform that we use to guide our decisions and to help you. There's 4 pillars, and we believe that those 4 pillars will resonate with you. And it just shows you that we have rails that we run on, and it's not the wild, wild west. We have created large success stories, and we just continue to replicate those. And a huge part of that is just the relationship and the trust and latitude that you give us to suggest things. Some of these things you're going to say, well, why didn't I think of that? Why didn't my other broker think of it? Boy, I totally get this. But help us help you control your costs by providing you the data, by providing you the top used prescription drugs, by providing you the top illnesses, and then seeing if there's programs out there to mitigate the costs or control those items. It doesn't sound that complex, but when the 3 of us go into an employer, we find that those items are not discussed. And it makes so much sense, it hurts, but that's the reason why we're taking this to the airwaves and the podcast and sharing our stories. Matt?
No, enjoy the discussion today. Would love to hear from you and work with you on your program.
Guys, Benefit Builders out. Happy New Year. We're looking forward to a great 2025. Look at our YouTube page. Go to our website. Check out our podcasts. We appreciate you so much. Bye-bye.
Bye.
Stop.
I would have to say that's one of our best ones yet.
I